Morning, panel. Thanks for your evidence so far. Stephen, Morgan, I'd like to go back to something you were discussing there about social work almost getting its voice back. And I guess sometimes when I'm listening to these discussions, I think the other voices that can go adrift sometimes are the voice of service users. And I think it would be helpful to understand, for committee to understand what it means for our citizens when there's structural barriers in the way, when departments are separate, you know, if because people's lives don't fall into boxes of children's services, justice services, housing. Can you talk a bit more to that, and also what it means for an individual, what the social worker does for the individual when they have that voice in terms of linking everything up?
I'm just wondering if Pauline might like to come in first on that.
Yeah, absolutely. I'm so glad you mentioned that, because I was just thinking we've had a lot of conversation about social work, but there's been a few people who are deeply invested in care who've been absent in the conversation. So thank you for shifting the conversation that way. I think so I work personally with a huge number of people who are either using social care or are struggling to get access to social care through self-directed support. I'm part of these collaboration spaces where I hear really similar messages all the time. It doesn't matter if you're in a rural community out in the Ardnamurchan Peninsula or if you're in the East End of Glasgow. There are comparable challenges to people when it comes to overcoming layers of bureaucracy. So I would say that we regularly, and I think our members would agree, have people who don't know where to turn, they don't know what to do. There's even a lack of clarity sometimes that social work is the gateway to be able to get social care support. Folk don't really know that. I think there's a huge piece of education needed nationally for people, your ordinary citizens, to understand social care and social work, because there are still myths and misconceptions about social workers have got a bad rep with an awful lot of people. Care and support is stigmatised for many communities, and there are attitudinal barriers in the first instance, but there are also significant structural barriers for dealing with different people. The lack of named social workers anymore, the care management approach where you're funneling people through this assessment, setting up a package, getting them out the door as fast as you can, and not having that. I would liken it to the family GP of old, where you knew where you were going to, you knew the person that knew your family, knew your patch, and was able to give that ongoing support and advice. That doesn't exist in the current model of social work, because we've shifted away from that relationship-based focus into this care management model. So I would say that there are huge challenges faced by supported folks in accessing, navigating and getting what they need out of social care. And that's not even getting to the difficulties in finding a support service to be able to actually meet their needs, and the thresholds of eligibility criteria, meaning folk are having to be absolutely burst before they can get support. So a small number of problems, I suppose it would be fair to say. And that's not even taking into account local practice and policy around eligibility and how that all fits together. So I don't envy them. I'll just give a wee example. This is from my own practice in Control Scotland rather than the SDS collaboration. But I did a piece of work with a group of social workers where we asked them to map out the system, to draw how does somebody come in, what happens to them when they're in there, and how do they come out the other end. And we ended up with this massive, really complex, unwieldy piece of paper on the wall. And a social worker took a step back and she said, "This is stupid." And I said, "What do you mean this exercise is stupid?" She's like, "No, my job's kind of stupid, isn't it? Basically, my job is to circumnavigate. There are processes there, but they don't work. So my job is to create these little back paths around about the system to get the outcome that I want. And it just devalues the entire system." So I always think about that massive roll of paper on the floor and a social worker's reflection of, my job's kind of stupid, isn't it? And I think, actually, the role of social work is incredibly important. Social workers, it is not a stupid profession, but what we've done is complicate it and make it unwieldy and challenging for folk to, practitioners and disabled people alike, to navigate.
Pauline.
I think if I can just make another comment on resourcing, again thinking from the supported person's perspective. So I know I was part of the Expert Legislative Advisory Group, and I know an awful lot of people who are living with disabilities or health conditions or are unpaid carers who have been part of the co-design process. And I think there is a bit of distrust out there now, because there has been this what felt like quite a rushed service and process in the ELAG, the Expert Legislative Advisory Group. It was really intense. It was quite time bound, and it was a lot difficult for folk to engage meaningfully. And in the co-production sessions as well, I suppose lots of people don't necessarily see themselves reflected in it. I think if you're looking for ways to build up trust again, there's something fundamental around the makeup of the decision-making processes that feels contrary to the ambitions of what I think a lot of us wanted to have in a truly co-designed national care service that values the voices of lived experience. At the moment, folk who are with lived experience on decision-making boards are limited to one rep. There's no other group that's limited to one rep. There's nothing about how they'll be remunerated within that. Or people are expected to give their time for free. That's not valuing it. There's also a significant cultural shift that will be required. It's really tough if you're used to having power and being able to make decisions and then having to work in a different way. So that training and support is needed for everybody to make it really collaborative. So I think there's something really bold that could happen, that is about a real proportionate representation of lived experience that encompasses lots of different types of voices, lots of types of experiences, remunerates and trains them and supports them fairly, and as well seeks to challenge the culture of power that some folk are just more accustomed to.